Good morning, people from Atlanta. That is so much nicer to hear. And those that are online, I hope you said the same, but you're not from Atlanta, so I don't care. But you could say what town you are from, all right? So good morning to you all as well. Thank you for being here. This is a very special program that we're doing. This is the first time that we're doing this type of specific program. And so I'm glad that we're able to help make it happen. Today's program, I want you all to know, is sponsored by Sandoz Pharmaceuticals. And so let's give them a round of applause and thank them for supporting this. Thank you. Exhibiting today, we had Alexion and Genentech, Novartis. TG was not here, but they were supposed to be here, and Viatris, okay? So we want to give them thanks as well, and of course I have to thank you all too. So this program today is called Multiple Sclerosis in the Black Community. It is different than other programs that we've done because we want to just focus on what is the difference of what MS is like for those in the Black community. So Dr. Williams, who you all know from the local area, is a very well-known neurologist. She's going to be up here presenting in just a few moments. She's going to be speaking about joining the conversation and going to be speaking about diversity, inclusion, healthcare issues, access to care, health disparities, sharing perspectives, and more. In addition, after Dr. Williams does her presentation, we're going to have two patient advocates that have worked with MS Views and News. One that does it a lot. His name is Damian Washington. The other one is Dawn Morgan. Dawn will be doing a lot with us going forward. Dawn is from the Washington, D.C. area, actually in Maryland, and Damian is from Los Angeles. They're both going to be online. They're going to have a conversation with Dr. Williams after her presentation about many of the things that she talks about and how it relates to them and their communities. After they do their conversation with the three of them, then we're going to open it up to the floor here. I want you all to ask questions, okay, or bring up, what you feel is going on in your own community, okay, that relates to the topics that we're talking about today. All right. So let's welcome Dr. Williams. She just sat down, but she shouldn't have done that. So come on up, Dr. Williams.
Good morning. Ooh, okay. Y'all awake? All right. Well, good morning. Hi, everybody. I'm Dr. Mitzi Williams. I am a board certified neurologist and fellowship trained multiple sclerosis specialist. Very excited to be here with you all today to talk about a topic that's very important to me. I see some faces that I'm familiar with. I see some new faces, and then I see some faces of people that I saw at my program last week. So Joy Life Foundation had a program focused on shared decision making and MS in the Black community as well. So glad to be here with you guys, and let's get right into it. All right. Very good. So, when we talk about MS in the Black community, there are a lot of things that I like to make sure that we kind of level set when we're talking about a topic like this. One of them being one of the biggest issues that we see affecting underserved or minoritized communities are health disparities. Does anybody know what a health disparity is? I mean, you ain't got to give me a definition, but okay, well, let's talk about it. Okay, so basically a health disparity means that people have the same condition, but they're receiving different treatment, not because their condition is different or not because it's more severe or whatever, but just because of other factors such as how much money you make, such as the color of your skin, such as, where you live, etc. So these health disparities can really affect our communities. And so basically it's affected by your ability to access good care, your ability to access good providers. Fortunately, you're in the Atlanta area. There are many MS specialists in the area, but there are many parts of the country where there are no MS specialists within like 5 or 6 hours. Okay. So there can be disparities in your ability to access quality care. So these things can affect health outcomes. And I think it's also important to recognize that, yes, we're talking about MS in the Black community. It's Black History Month, but there are many underserved communities, right? There are people who live in rural areas, maybe who can't drive or get to a certain specialist. There are people with other disabilities, right? Older patients, and let me be clear, about old. For me right now, old is like 90. Anything under that is not old. Okay. The 55 is definitely not old. But certainly people who are older, right? People who don't have English as a primary language, right? So there are many, many communities that are underserved. And again, this can be important because they can have higher mortality rates, higher rates of disease, more severe disease. And this is something we see across the board, not just in MS, but in many other areas of medicine. If I go to a conference and we talk about hypertension, we talk about heart disease, we talk about diabetes, many of these outcomes can be worse in our populations because of some of these factors. All right, what do we know about MS in the Black community? This is a slide that I like to put up, not to scare people, but to kind of let us know the serious nature of the issue, right? When we think about the prevalence of MS, that means how many people are being diagnosed or how many people are living at one period of time with a condition. The prevalence of MS in the United States is very similar between Black and white people, okay? And this has come a very long way because when I was doing training, we thought Black people didn't get MS, okay? We thought that Black people got MS about half as commonly as white people got MS. And we're finding when we look at the numbers that this is not true. This is a study that was done with the Kaiser Permanente group in Southern California. And you can see the white group is in the blue line and Black is in the black line. And you can see those numbers are pretty similar, okay? But it's primarily driven by women because MS affects women more than men. So if you look in the middle, my clicker doesn't work, but if you look in the middle column, that's women, and you can see those numbers are similar, but much, much higher than the numbers in the last column, which is men. All right. So when we talk about health outcomes, we have to talk about these things called social determinants of health. Anybody heard of social determinants of health? Now, if you saw me last weekend, you heard about social determinants of health. I see at least 2 people that saw me last weekend. Okay, I'm just messing with you. Okay, so social determinants of health are the conditions in which we live, work, play, grow, age that really affect health outcomes, right? So when we think about health outcomes, we think, can you get to the doctor? Can you get your medicine? Can you afford your medicine, right? But what we're finding is that these social determinants of health, often things you can't control, probably have more of an impact on how well you do or how poorly you do with a disease than the actual medicine you take. Okay. So these are things like bias in the system, right? Experiencing discrimination when you go to the doctor, not having your symptoms believed. Also your socioeconomic status, your access to resources, your access to care, whether it is super specialized care, your access to culturally competent care, your access, your health literacy, right? And also the underrepresentation in clinical studies, which we'll talk about a little bit later. So all of these things kind of that you can't really control have almost like 50 or 60% of an effect on your outcome, even more so than the medicines that you take. So these are things that are really important. These are things that we in the scientific community are really looking at to better understand so we can make sure that everybody gets access to good care so they can do their best with MS. All right. So why is race important, right? So, there are a lot of conversations around diversity, equity, inclusion. They've been going on. A lot of people are now there's a lot of pushback. A lot of people are anti-diversity, equity, inclusion, and DEI initiatives, things like that. And, when we think about it kind of in the 50,000 foot view, race is a social construct. Do you guys know what I mean when I say that? Yes, no, maybe. You can nod your head. I'm not going to call on you. It's no pop quizzes. Y'all look like y'all scared. Or do y'all need some bread? Y'all scared or y'all need bread? Or both? Okay, you scared and you need bread? Okay, good. All right, Stuart, tell them to bring the bread out. All right, so when we look at the 50,000 foot view, race is a social construct, right? It is an arbitrary thing that's inherited, right? Meaning it has no biologic basis. Any difference than if we categorize people according to height, right? If we said all the tall people have this characteristics and all the vertically challenged, I won't say short, vertically challenged people have these other characteristics. It's arbitrary. Okay. So it is not biologically based. It's inherited. We have different levels of melanin in our skin. It does not confer biological differences, on a whole. Right. However, the other things I think when we think about race is that it's self-reported. Right. So you are what you tell us you are. And we've all seen instances in the news where somebody said they was Black and we found out they weren't Black. They just had a really good suntan and got somebody to do their hair, right? And then there are other people who, I actually saw a documentary about a young lady who clearly looked black, but her parents told her she was white. And all her life, she thought she was white, even though she clearly looked black and was black. Okay. So again, race is self-reported, right? So again, these are things, to make us understand, number one, we spend a lot of time, in history as a people, making sure people recognize that we were pretty much the same, right? Because there were a lot of, thought processes about black people back in, 200 years ago, that we weren't smart, and et cetera, et cetera. But the reason that this is important is because it does affect outcomes, right? And so until we can get to the bottom of why we see the differences in the outcomes, we have to use this kind of as a broader category to help us understand what are the other factors that are leading to more severe outcomes in our populations versus others. Does that make sense? Yes, no, maybe. So bring on the bread. Okay, gotcha. All right. So when we talk about social determinants of health, again, those factors that we can't really control that impact our outcomes, these are a couple of studies that looked at social determinants of health, or actually this is a little bit of data. So when we look at economic stability, if someone has a lower annual income, it can affect your ability to access healthcare. If you are, for instance, in a minoritized population that may have poorer outcomes, you may have a higher rate of unemployment, which then affects your ability to get health care. Also, your access to specialty care is important. Certain perceptions of illness, a person's poor lived experience can affect it, as well as your education. So again, all of these things can affect your health outcomes. And this says nothing about what medicine you're taking. Okay. So there are a lot of other factors that can play into it. All right. So what are some barriers to care in diverse populations? These are just a list of some of them. Certainly systemic racism is one. Bias and misdiagnosis. I still have people coming in my office in the year 2020. Oh, 4. I was about to say 3. 2024 saying my doctor told me black people couldn't have MS, right? Which we've known for decades is not true. Certainly lack of access to responsive providers. I have other people that come and say, I went to the doctor. I told them I was having this problem. They didn't pay any attention to me. They told me it was stress, right? And then, of course, there can be also distrust of the healthcare system, right? And then lack of diverse ethnic providers. Again, we live in Atlanta, which I call Wakanda. There are 5 black MS specialists in Atlanta alone. Okay. And that's probably a quarter of everybody in the country. Okay. Those 5 of us. Right. So again, there are certainly many barriers to diverse care. And so we have to be aware of those. And certainly many of us who are physicians are trying to address these. This is another study that was done looking at socioeconomic status and these social determinants of health. What they found was that Black and Hispanic people with MS seem to have higher, morbidity or severity of disease. There was low representation in clinical trials, which limits our ability to kind of generalize information, right? So if everyone is not involved in the research that goes behind our medicines and behind our treatments, it's difficult for us to say that all of this knowledge applies to everybody equally because everybody wasn't included in the way that we found those answers. All right. Okay, now let's switch gears, right? So what can you do, Dr. Mitzi, after you've depressed us and talked about all this stuff that's horrible? Okay, so what can you do to help yourself, right? So I am a firm believer in patient empowerment. I'm really excited for our conversation later with Dawn and Damian to talk about, kind of how you empower yourself and how you engage in the healthcare system. One of the ways that you can engage is assembling your healthcare team, right? So when we think about the healthcare team of a person with MS, there are often many parts. So certainly you have your neurologist, right? Who's the person that is primarily helping with your MS, helping you with medications, often helping with many of the symptoms related to MS. However, sometimes there are other specialists that are involved, right? So I usually am very clear about this is my lane over here. And once we get out of my lane and it's somebody else's lane, I'm going to send you to somebody who works in that lane. Okay. So sometimes there may be additional specialists like urologists or gastroenterologists. Sometimes we need physical therapists, occupational therapists. Sometimes we need mental health therapists, right? So all of these different people make up your team. And it's important to try to find the best team members you can. In a perfect world, you will find somebody who identifies with you perfectly, but that's just not the case, right? Everybody's not going to have all doctors that look like them. But certainly there are many doctors who are empathetic, who listen to you, who are willing going to help you. So it's important to find those right members. And if you have a member on your team or a physician that you feel like is not listening to you or you're not getting what you need, it's okay to find somebody else and get a second opinion, right? I talk a lot with some of my friends about firing your doctor. Okay. If you ain't doing it, they ain't doing what they need to do, fire them. Okay. And find somebody else, right? Think about it. If you went to a hairstylist and she jacked up your hair, right? Or fellas, you went and got a cut and they jacked up your line. Are you going to keep going back? Y'all going to keep going back? Absolutely not, right? But sometimes with doctors, I hear my patients say, oh, well, this person diagnosed me. I was just loyal to that person, even though they weren't listening to me. Doesn't make any sense, right? So in other areas of our lives, if we're not getting what we need, we move on. And in the same way, if you're not consistently being listened to, you've approached it or tried to address it and it hasn't gotten better, then it's time to move on, okay? Because you need somebody on your team who's willing to walk through this journey with you with MS. All right, so shared decision making. So this is also an important aspect of your care. Shared decision making means that you and your healthcare provider sit down, have a conversation about what the options are, what's the best treatment for you, and then you do whatever is based on the best thing for you, okay? And that's going to look different for each person, right? So, traditionally in medicine, you go to the doctor, they tell you what to do, you go home and do it, right? It doesn't work like that anymore. So we like to sit down, have conversations. I like to give my patients information, let them go home, read it, come back, bring your family, bring your mama, bring your daddy, bring your cousin, whoever helps with decision making, and make these decisions together. So part of decreasing health disparities and improving care in populations is to understand what good care looks like. So you have to know what good care looks like to know that you are or are not receiving that. Okay. And then also, I think one of the bigger things that we have moved to is really trying to personalize treatment for MS. So when I started practicing, we had about 4 medications for MS. Now we have over 20. So things have changed quite a bit. So the conversations are a lot different than they were 15 or 20 years ago. And so our goal now is to look at all these factors and again, try to put those together to find the right plan for you as an individual. And that's what your healthcare team should be doing, right? We look at your MS. How is it doing? How long have you had it? We look at you. What can you take? The best medicine is one that you can take. Do you have other medical conditions that will interfere? Are there any other personal factors or preference about your treatment? And then, of course, we talk about the treatment. And when we put all those things together, we come up with a personalized plan for you and your MS. Sorry, I got my timer up here to make sure I stay on time. Okay. Next, so I had a list of the disease-modifying therapies. I'm not going to go through that, okay? But certainly, again, you can see it's come a long way from the 3 when I started. All right, now let's switch gears a little bit and let's talk about research, right? Because I think this is really important. And when we talk about research, there are many different types of research, okay? So all research is not necessarily clinical trials where you're receiving something experimental. But when we think about MS, we know that there is potentially more severe disease in Black populations. There may be more progression. When we try to understand that, the best way for us to understand that is through research, okay? And so when we look at the clinical trials for our disease-modifying therapies, okay, our MS drug trials, we can see that the participation of Black people is anywhere from 2.3 to 16%. Most trials are 5% or less, okay? So the 16% is a really just one trial, okay? So we're mostly less than 5%. And then when we look at Hispanic people, it's 7 to 7.5%, okay? So again, when we're looking at a disease that is really disproportionately affecting Black people in the United States, 5% enrollment in clinical trials is not a lot of people, okay? We cannot generalize to a whole population of people based on 10 people who were in a study or 20 people or even 30, right? We got 20 people here. Okay. So again, it affects our ability to generalize the results. So when we talk about clinical trials, I always think it's important to take a pause and talk about mistrust. Often when I'm in circles with my colleagues, they say, oh, but people don't trust and mistrust, right? So that is an issue, okay, that certainly needs to be addressed. There were many historical injustices that occurred. The picture on the left is of people participating in the Tuskegee syphilis study. Who knows what the Tuskegee syphilis study was? What was it? Okay. They weren't giving them anything. Okay. They were observing. Okay, now, so let's be clear. When the syphilis study started, okay, there was no treatment for syphilis. Okay, so it started as an observational study, which sometimes we do. If we don't have a treatment for a condition, we want to know what we call the natural history, right? So what happens to people over time. The problem was once the cure for syphilis was discovered, it was not offered to these people, okay? So in the beginning, there wasn't a cure. They were being observed, but then once the cure became available, it was not offered and actually was intentionally withheld, and most people were observed until they died, okay? So that was the injustice of the study. In the middle, we have a picture of, one of the slave women who we learned a lot about the female anatomy from. Many people were experimented on without anesthesia, et cetera, et cetera. And then this is a great book called Medical Apartheid, which talks about a lot of stuff. Okay. So because of many of these injustices, there are now a lot of safeguards in place for clinical research. Okay. So when we talk about clinical research now, they can't snatch you off the street and take you to the back room of the hospital and give you something and throw you back out. Okay. It doesn't work like that. So there are many protections in place now. There are many reviews that need to be done. So if Dr. Mitzi wanted to do a survey research study of everybody in this room, I have to go to a review board. I have to get that questionnaire approved before I can even give you a piece of paper. Okay, so imagine what has to happen before somebody can give you an actual medication or do a procedure, right? So when we think about research, these are kind of the phases of clinical trials. We have preclinical phases where studies are done like in animal models and things like that. By the time most people come to research or you hear about it at your doctor's office, you're at phase 3. Okay, so that means that hundreds of people have been on that medication. They know about the side effects. They know about some of the risks, and they also have an idea if it works. So by the time most people come to review, or come to hear about research studies, they're in phase 3. And then, of course, the FDA reviews and approves medications, and research continues once a medication is approved, right? So it's not like it's approved and then we say, okay, have a nice life. We don't know what's going to happen to you, okay? People are continued to be studied, and if there are new side effects or issues that arise with that medication, once it's available, all those things are reported to the FDA, and that label has to be updated. Okay. So please understand that any type of therapies are continuously studied. And if there are new issues that arise, those are reported and then reported to your doctor, who can then report them to you. All right. So the stages of research, again, just kind of thinking through this, informed consent. So before you participate in any kind of study, questionnaire, etc., we have to give you documents to tell you exactly what it's about. They screen you. If you're eligible, you become a part of the study, you follow up, and then they give you results. And every study is a little bit different. So this is kind of the typical thing we look at with a clinical trial. But again, clinical trials aren't for everybody. And then when we think about research, also, it's important to know that you have rights as a research participant. Did you know you have rights? Has anybody here participated in a research study? Okay. Has anybody ever been asked to participate in a research study? Okay. Okay. All right. So again, this information I think is important, right? So it's important for you to know what your options are, whether you decide to participate or not. It's important for you to know that it is an option, and it does help us to better understand why we see certain outcomes in our populations. So you do have rights as a research participant. Number one, to know what is going on with the study, why it's being done, to ask any questions you want to ask. And then I think the most important one is at the bottom. You can leave at any time, right? So if you decide to participate in a study and for some reason you don't feel comfortable, etc., you can withdraw your consent. So you are not signing over your life. You're not signing over your firstborn or nothing like that. Okay. If you want to come out, you can come out. And also there are often protocols in place so that if, let's say, something happens, if your MS starts acting up during that study, there are protocols in place to get you out of the study and to get you treated appropriately. Okay. So again, it is not usually observational where they say, all right, we're going to put you in this study, see what happened. You have a relapse, you go down here, we just going to keep seeing what happens. Okay. It doesn't work like that. So again, many protections in place, but also important to know your rights as well. And so these are resources that you can look at if you want to learn more about research, different types of research. And then the other piece that I think is important, well, I'll go through this in a second, the Chimes trial. Okay. But I think the other important piece is to recognize that there is more to research than just clinical trials. There are registries, there are questionnaires, there are exercise studies, right? So there are studies that enroll to do different exercise programs to see how you do with exercise for your MS. There are studies about diet. There are studies about meditation, mindfulness, all kinds of things, right? So even if you are interested in natural ways to heal or deal with your MS, there are studies for that, right? So the best way that we learn knowledge about how different interventions do or don't work is through the process of research. So these are just a couple of resources. There's the National African American MS Registry. There also is a Hispanic Alliance for MS Registry. There's I Conquer MS, which is another registry. So there are survey-based interventions as well as many other things. And so the thing that I encourage people to do is just get in where you fit in, right? Clinical trials may not be for you, but I think there is something that everybody can do to help us to better understand MS and to help us to better treat everyone. So when one person participates, it helps everyone else that comes behind you where we didn't have that knowledge, if that makes sense. And then one example of a study is the CHIMES trial, which I am one of the co-leads for. And this is a study that's ongoing that's focused on Black and Hispanic people with MS. It is the first clinical trial ever to focus on Black and Hispanic people living with MS in the United States. And basically what we did was we had a very collaborative approach to this study. So we had patients come in and we were like, hey, we want to do this and this and this. And there were cases where we as the physicians were like, nah, people ain't going to do that. And the patients were like, what you talking about? We want the best study, right? So again, making sure that we include your voice, right? And I think there's a really big push, again, which is why I'm excited that Damian and Dawn are here, because I think it's important to include the patient voice. So many times we as healthcare providers get up and tell the people what we think they need and what we heard other people said, but you need to hear it from somebody who's having the same lived experience as you. All right. So again, wide variety of places you can find out about research. If you are eligible for research, again, do your homework. But if there's a way you can participate, I encourage you to do so. All right. So again, when we're talking about kind of just looking at things as a whole, it's important to take control of your health, right? Learn about your diagnosis. You come to programs like this, which are important. Understand your treatment options, okay? That collaborative shared decision-making is key with your doctor. It's important to look at things like diet and exercise. So I'm a big proponent of lifestyle modification. I didn't really get into it in a lot of detail here, but what we're finding is that, okay, medications play a part, but they do not get rid of the part that you play in your own health, right? Eating a healthy, well-balanced diet, which y'all eat. Okay, y'all only on the salad, so you well-balanced right now. I don't know what's coming next. But eating a healthy, well-balanced diet, getting a little physical activity in, okay? Does not have to be putting on your Ivy Park outfit and working out for 5 hours, right? Can be walking for 10 minutes, walking for 20 minutes, whatever that looks like for you. And then talking to your healthcare team if you're having issues. If you have questions, don't be afraid to ask them, to find your tribe. Come into programs like this where you can have the support of other people who are having your lived experience, I think is extremely important to living well with MS. And then remember that you're your own best advocate. Okay. So those are all really important things to try to make sure that you are kind of taking control of your health, being an advocate for yourself, and making sure that you have the best outcomes with your MS. All right, so this is how you find me. I am the Nerdy Neurologist. Oh, I think I'm right on time, Stu. Okay, I might be 2 minutes ahead of time. This is how you find me. I'm the Nerdy Neurologist. I do a lot of programs with Stu. I also have a podcast called Brain Chat with the Nerdy Neurologist. That's me when I got to go on the Sherry Shepherd show last year, which was a lot of fun. And again, at the end of every talk, I always say, all I need is peace, love, and a freaking cure for multiple sclerosis. Thank you very much for your time and attention. And I think we will have Damian and Dawn. It's okay to clap. I think we will have Damian and Dawn come up and we'll talk a little bit with them. So these are two of my favorite MS advocates. We've done a lot of work together. So it is always a joy and a pleasure speaking with them and having them share their experiences. So first, just kind of level set us, and I'll start with Dawn and then go to Damian. Just tell us a little bit about your journey with your diagnosis of MS and how you became an advocate to start speaking out about your experience and sharing that with others.
Yes, thank you so much. I'm really happy to be here with everyone. I was diagnosed with MS May 23rd, 2000. Won't forget that day. And I came about learning that I had MS through pretty much trial and error, trying to figure out, was this rheumatoid arthritis? Was this lupus? What is this that's plaguing my body? I went to several doctors. I went to first my primary care physician, and she said, "Oh, well, you're a vegan, and I think you're vitamin B12 deficient. So why don't you go on vacation?" At the time I was teaching, go on your winter break. And when you come back, we'll do an MRI. And so I thought, okay, well, I'm having these issues because I'm vegan. No, that's not a problem. Well, I was feeling numbness, tingling, and extreme fatigue over my vacation. And it was pretty scary. So when I went back home, back to DC, I said, something is definitely wrong. And I think it's more than just an iron deficiency. Can you please do something to help me figure out what the issue is? So at that time, she sent me to to get an MRI. And at that time, the radiologist reported that it looked like multiple sclerosis. So my initial journey was it was unlike a lot of other individuals that I've spoken with in the African American community. I don't want to say it was seamless, but I had a chance to utilize my voice, ask questions, and feel comfortable with the initial neurologist that I saw. Although he had a hands-off approach, he was more of I would say a conservative. He didn't really want to do a lot with my MS at the time because he thought that I had a clinically isolated situation. And I don't think Dr. Williams explained, but I'm sure you can find out all the different types of MS. But he thought it was CIS, clinically isolated syndrome. So my parents and I decided that wasn't the case, and we needed a more aggressive approach. And I ended up with the neurologist that I have now, and she diagnosed me officially with multiple sclerosis. But
who's amazing? I saw her yesterday.
Okay. I'm sorry?
I said, who is amazing? Your neurologist. I saw her yesterday.
Oh, yes. Yeah, I just saw her about 3 weeks ago. So, yeah. The last thing I'll say, just to sum up my initial diagnosis story, is the only barrier that I ran into was the very first neurologist not really wanting to be aggressive. Like I said, he just felt as if it would go away. And I wasn't comfortable with that. And it's hard to tell if he was even completely listening to me or he was wishful thinking because I was so young. I was 25. I'm not really sure what the case was, but it pushed me in a good way to seek a second opinion. And I love what you said and what you addressed the audience saying, be your own advocate. You are your best advocate. So using your voice from the start is the best way to go.
Yeah, so many things, so many nuggets in your journey, Dawn. Certainly I heard you say, you made sure you got a second opinion. You didn't feel comfortable with the way you were being treated, not that you're being mistreated, right? Because our thought process about MS has really changed over time. So not too long ago, we were saying, okay, clinically isolated syndrome, which is the first episode of symptoms that will then go on to develop MS. There was a time when people weren't treating that. They were waiting for that second episode to happen. There was a time where many of us didn't start aggressive therapies or high efficacy therapies early, but again, having someone that aligned with what your goals were and what you wanted to accomplish is extremely important. And you didn't get that. And so you sought another opinion to get what you needed and wound up with a fabulous doctor. So Damian, tell us about you, my friend.
Peace, y'all. Firstly, thanks to MS Views and News, thanks to Stuart, and thank you for Dr. Mitzi Joi Williams and her wonderful insight, and presentation, and presence. And lastly, thank you all who are here in attendance to get some of this information and share in some of this MS community. I'm someone who was diagnosed about 7 or so years ago, and my energy, I'm a high energy person, and my energy was increasingly dipping. And then my walk started being strange, and my vision started being strange. And my wife, someone who we've been together since our first year of college, and we're in our mid 40s right now. Somewhere along the line, she's like, something's wrong with you, man. Like, I don't know what it is, but something is wrong with you. And 4 different doctors later, we were taking a walk, my wife and I. And after that walk, we came home and I went to take my shoes off from being outside, and I fell, and I was looking at the ceiling. And at that point, she was like, that's it. We are going to emergency care, and we're not leaving until we know what's wrong with you.
So, Damian, before you go on, tell me about those 4 different doctors. What happened when you went to see, because you saw 4 people and then you still fell to the ground without a diagnosis. Tell us what happened.
I went to the podiatrist because my feet weren't doing so well. I cannot remember the other 3. I know they're totally 4, but essentially each symptom I was having, I was going to see a specialist for that symptom. So if my gait was wrong, I went to the walking person. If my eyes were wrong, I was asking my vision person what was going on. And each of those specialists were like, you look fine to me, but you are clearly not fine, young man. And the emergency care technician, when we went to emergency care, was like, well, I don't know what's wrong with you. Get an MRI. The MRI readout said, oh, this guy, he's healthy. He's fine. He totally has multiple sclerosis. He needs to get a specialist and get that worked out. And so that was the beginning of my journey. Everyone's saying I was fine, but I clearly wasn't fine. But an MRI revealed I totally have multiple sclerosis. Figure that out, young man.
Yeah. So I think that that's really important, right? Because again, one of my goals is to, educate our medical community, right? That all different types of people get MS, but also educate our community, right? We know about high blood pressure. We know about sugar, diabetes. We know about all these conditions, but we don't know about MS, right? So we want to make sure that also our, general community is educated so that if people are having these symptoms, at least MS comes up somewhere in your mindset. Because now I have people that come and say, I think I have MS. I Googled my symptoms, right? And sometimes they do, sometimes they don't. But that's not a conversation that we were having at the time that you were diagnosed, Damian. And when you are seeing the doctor, somebody has to have a suspicion, right? Because MS symptoms are very common to other conditions. A pinched nerve. I've had people that have been diagnosed with all kinds of things. But if there's nobody that has that suspicion and does that MRI, it may be a very long time before it's found. Okay, so I think that's extremely important. So when we talk about access to care, were both of you guys, did you start with MS specialists as your neurologist, or did you start with people who were knowledgeable about MS?
Dawn, I'm always defer to you first. Ladies first. Go ahead.
Yes, I started, well, no, actually, because the first neurologist that I saw, he was not a specialist. He was a very fantastic neurologist, but he was not an MS specialist. And I was blessed and lucky enough to have parents in the medical field that knew someone had worked with my current neurologist. And they said, nope. I'm sure you are happy with the person that you're seeing now, but I think she needs to see, an MS specialist, someone who completely understands what she's facing and what has happened, and someone who can walk with her. And I'll tell this brief story. And my father said this in our documentary, Dr. Williams. When I met with my doctor, she said, I want to grow old with you. My dad asked, well, what is it? And she said, it's MS. And she said, I want to grow old with you. And it's been 24 years, and we never forget that as a family. And we honestly have grown older together. She informed me how old she will be this year.
Not old, older.
She's not old. Right, exactly. So to answer the question, I did not initially see a specialist. I just saw someone who was a neurologist. And it took me years to figure out, okay, well, what's the difference? And my doctor, my neurologist, MS specialist said, I'm the specialist. I am your MS specialist. So yeah, it's important to know the vocabulary.
Absolutely. What about you, Damian?
Well, I was aiming to get a neurologist, like the MRI readout said that I should. However, it was a 3 to 4 month waiting period to get a neurologist in the Los Angeles area at the time. And one of my college friends, her husband is a doctor, and we're just hanging out and talking. And he is like, wait, what? Hold on. Let me get your printout and let me have one of my colleagues confirm this for you and point you in the right direction. And that person was like, okay, no, you have MS, my guy. And you can try to go here, here, or here. And then as that happened, that's when things began to open up for me. Otherwise, if I was just on my own and I didn't happen to go to this university in this way, and we had a collegial relationship with people, I would have probably still been 3-4 months out of even being able to see a neurologist, which, talk about a disparity. That's, it's hurtful to think that was a factor in me getting proper care.
Yeah. And I think, my encouragement to everyone, is that at some point in your journey, it's helpful to see an MS specialist at least once. Now, there are many parts of the country where there are amazing general neurologists who treat MS. There are some who are very passionate about it, who look up, the research, et cetera. And oftentimes we have a combination of things. So I have some people that just see me as a specialist. I have some people, if they live 4 or 5 hours away, they have a local neurologist. If they get into trouble locally, they come see me once or twice a year. Sometimes they come see me for a second opinion, and their local neurologist is excellent and they stay with them, right? But I think at some point, at least one time in your journey, it's important to see a specialist. If you can follow with a specialist, it is helpful because the treatments and the ways that we're looking at MS have really changed drastically, just even over the past 5 to 10 years. So if somebody's not keeping up with that, they may not be aware of some of the newer things that are going on if they're treating all aspects of neurology. So that's really important. So let's talk about expensive. So MS is an expensive disease, right? We got MRIs, we got deductibles, we got these medications. So talk a little bit about, kind of the affordability, of treatment with having MS, or the lack of affordability, and how that may or may not have impacted you guys.
I chose the alternative therapy route in addition to adhering to the medication, the DMTs that my doctor had prescribed. I felt like having that discussion with her was going to be a healthy balance for me, spiritually, mentally, and physically. And along that road, I realized this is quite expensive. Getting, for example, massages. I remember early in our meeting and in our journey, there was a doctor, a student that had come from Switzerland and was studying with my doctor or my MS specialist. And she had told me later on that in their country, they prescribe after the appointment is done, they prescribe massages for their MS patients. And I thought, well, why aren't they doing that here? Do they understand that manipulation of the muscle is going to help us? It's going to help with the spasticity and with this contracting of our muscles and the pain and things like that. But, at the time I was not married. I didn't have any children. So I had the money. It was just me. So I was on the table every week getting massages, as well as acupuncture, as well as doing Qigong and yoga. I just felt that overall it was helping, and joining meditation courses. It did provide that healthy balance of keeping me sane, for lack of a better word, and in alignment with adhering to the medications, which I really had a push. I pushed back quite a bit. I didn't want to take it. I was afraid because of the historical context that you spoke of earlier, Dr. Williams, not because of my specialist, just because of medication overall in the healthcare industry. But it does hurt your pockets, the other treatments that you will find, as well as the DMTs themselves. The last DMT that I took, it cost probably about $100,000. And if I didn't have good insurance at the time and the patient program that helps, I forgot the name of it, but they help with paying for your medication. And if I didn't have that, then I don't know where I would be. And I'm so grateful that we have things in place to assist patients that are, I guess, hitting a wall financially because they are really pouring into their disease. They're pouring into feeling better and having positive health outcomes. It costs. This disease is not, it's not cheap.
Ooh, so you said a lot. Okay, so you said a lot. So the first thing I heard was definitely about additional things you were doing to supplement with your medications, things like massage. Now, you called it alternative therapy. And so, I would say in the past decade, we've really changed that wording, right? Because when we say alternative, it sounds a little bit like you're doing one thing or the other. We now really call that field integrative medicine, right? So we recognize as healthcare providers that these things are extremely important to someone doing well with MS. That is not just about the medicine you take, but also about those healthy behaviors. The healthy behaviors that help your heart also help your brain. Has anybody ever heard of brain healthy behaviors? Yeah, diet, exercise, stress reduction, meditation, all of those things help your brain health, right? And the goal is to build up your brain to make it as healthy as possible so that if you do, unfortunately, suffer an attack from the MS, we have something to fight it with, okay? So all of those things can help build up your brain, what we call your neurologic reserve, and keep your brain healthy because those things can naturally kind of decrease over time. So the integrative medicine piece is extremely important. There are pushes now to have many of those things approved by insurance. Unfortunately, massage therapy is not there, but many insurances approve acupuncture now. They don't approve meditation, but now they're all kind of apps. Listen, Lil Jon released a meditation album. Anybody heard? It's actually really good. I listened to it this morning. So again, people are realizing that meditation, and I was waiting for him to say yeah in it, but he didn't say okay, but that's okay. He said it very subtly, like, okay. I was like, okay. Dang, he didn't say it like I wanted him to say it. But again, all of us are starting to recognize the importance of these different factors, right? And not that they are something that we can do without, that we have to integrate them into the medical plan to make sure everybody's doing their best. Okay. The second thing I heard you say was talking about kind of concern or hesitancy about certain medications because of like a history of thinking about the role of medication and kind of cultural issues. Let's talk tell me a little bit more about that. You and Damian.
Damian, if you want to, I can start, but yeah.
Let me hop in here, Don. I'll say this. Not iatrogenic illness, iatrophobia, okay? That's the term for fear of the medical system, fear of doctors and such, yeah? And historically, iatrophobia comes from mistreatment of African Americans by the medical system. And that book, Harry Washington's Medical Apartheid, that slide that Dr. William previously showed, that's a read, ladies and gentlemen, that you want to get on. And even if you don't read the book, get the audio. You want that information on your brain because there are some things that are beyond, oh, I'm still laughing, that are beyond anywhere acceptable or understandable in today's day and age, but were part of the practice of other times. And it's unnecessary to reach far back as the Tuskegee experiments and such. In my day, there's let's see, was that 1998? I was a junior in high school. And there were some rumblings with Columbia University and Black people and something. Come to find out, I read that book, Medical Apartheid. the university was giving 8 to 10-year-old Black children the diet medication fen-phen to see if it would keep them out of jail. Now, we all know fen-phen was a diet craze wonder pill that got pulled from the market because it gave people heart problems. It literally gave people holes in their hearts. But some Columbia researchers thought it would be a really good idea if we gave these Black children this medication to see if it would keep them out of jail, just to see. So this isn't such a long time ago, folks. And it's important to remember that and to walk in that, but it's also important to remember one's own power and to walk in one's own power. And when you don't feel as if things are correct, well, you have to figure out, the burden is on you to figure out how to make it correct. And if it's not this doctor or that doctor, then maybe this is what your MS network is for. Hey, friend in another state. Hey, friend across the country. What's going on? Let's compare notes with each other. And let me try to figure out the next thing for me. That's a really important thing to remember. And I actually forgot the initial question, Dr. Williams, because I really wanted to.
No. You answered the question, right? So again, I think when we put it in context, right, and we talk about things like mistrust, there's a reason for that, right? But I think at the same time, if we want to continue to move forward and find answers, we have to find a way to engage in the system, right? Absolutely. Now, if there's one thing we know how to do is how to do research. Okay. I'm in all these different Facebook groups. If somebody wants a new loctician, right, they like, okay, what are their reports? Let me go look at their Google reviews. Let me go look at this. Let me talk to 5 people. If you're looking for a school for your kids, if you're looking for a new car, right, I'm in groups where everybody's like, I got 3 kids. I need a 3rd row. Tell me about the specs, all of that stuff. So we know how to do research, right, in our everyday life. And so let's take that same level of care when we're thinking about the care that we're receiving, right? So the same way you wouldn't let somebody who did a bad job dyeing your girlfriend's hair dye your hair, okay? Don't go to places where you're not receiving good care. That's why these communities are important, so you can talk to other people and see what their experience is and help to find the best person that, will help you to walk through this journey with MS, to help guide you with different medications and things of that nature. So I think that piece is really important.
That's all. That part.
Yeah, that piece is important.
Can I add?
Yeah. So, go ahead, Dawn.
Just one thing. I do want to add about the mistrust. I feel like I was reluctant in taking certain medications because there were 2 issues that I had gone through as I was growing up. And I think clinicians need to understand and really dive deep into conversations with their patients. For example, I was in high school. My parents went to Tuskegee. The Tuskegee experiment was still taking place when my dad arrived his very first year. And I'll never forget, they were talking about it at breakfast one time. And I read this book. My dad said, yeah, you should read this book called The Tuskegee Experiment. And so I read this Tuskegee syphilis experiment. I said, well, I'm afraid of doctors. I'm never going. And that was implanted. That seed was there. And it wasn't as if he was providing this literature to scare me, but it was just for me to be informed. And then for my brother was having trouble in school, and he was misbehaving. And all the teachers were having issues with him. And he was throwing chairs and things like that. Oh, we're going to put him on Ritalin. Oh, we're going to just do a test and a trial and see what's going to work for him. Well, it turns out my brother had dyslexia. So he was acting out because no one was addressing the dyslexia. They thought he was just a bad Black boy. And those 2 seeds were implanted in me in terms of trusting the medical system. And I remember when I went into my initial office visit with my neurologist, I said, Mom, do you think they're going to try to experiment on me? And, I was so naive and didn't think about these things. But on a positive note, and I'll end with this, there have been tremendous changes. The last DMT that I took, I was very welcomed in that community. And I felt that I could ask questions. I felt that, there was comfort, there was safety. they called me and they monitored me for 5 years, which was amazing. And so feeling that level of community with a pharmaceutical company, as well as my healthcare team, as Dr. Williams, as you mentioned, it has definitely shaped my narrative now looking forward in terms of trusting the system and being a Black woman.
Yeah, so I think, again, you said so many key things there. There are many experiences that we have growing up, things that we may personally have experienced, things that our family members may have experienced. But again, when you are dealing with a chronic condition or any medical condition, it's important to find where you can engage in the system, right? The answer is not to go bury your head in the sand and never come back out, but to find the best way for you to engage with people that, with team members that you feel comfortable with, and to have those advocates with you, right? So if your best girlfriend or your family member, your spouse or whoever is with you at that appointment and their spidey senses are like, this ain't the right thing, then, it's okay to, again, continue going until you seek the care and get the care that you need. So I think that's really important. And so we just got about 4 more minutes left with this portion before we open it up for questions. And so I want each of you to, number one, talk about what encouraged you to begin to share your experience with others, and where do we go from here, right? So I'm really excited to have conversations like these. When I first started practicing, we didn't really have conversations like this with a room full of people like this. So I'm excited to see this, but how do we make it better? Where do we go from here? So I'll start with you, Damian, and then go to you, Dawn.
Where do we go from here?
Before you answer that, what made you start sharing your story, right? So you got a YouTube channel with thousands and tens of thousands of followers.
Dr. Williams, I'm just the charming nerd that sits and looks directly at the camera and properly answers questions. My vlog got started because, like you say, I'm in entertainment. I've done 36 national commercials and voiceovers for folks like Ring with Shaquille O'Neal or Realtor.com with Elizabeth Banks. So I've sold everybody in this room products for years. And I had a YouTube vlog to try to work with that career. So I'm getting on television longer than 30 seconds. However, the only videos that people watched were about my MS. And like thousands of people would watch these videos about me going to my infusion or doing the follow-up to that infusion. And as the seasoned entertainment professional that I am, you just want to give the people what they want. And the people didn't want my funny videos. They wanted my somewhat humorous videos about MS and about what you need to do when you go to your infusion center, what you should bring with you, and me speaking with other MS patients. They really wanted to watch that. So I turned the corner on that, and 4 or 5 years later, 6,000 some odd subscribers later, I'm one of the forefront people that are out here talking about MS and bringing the patient perspective more forward for us all.
And where do we go from here?
Where do we go from here? Man, I'd love to know, doctor. Why don't you tell me? No, it's everyone's journey is individual. And there are things that I can look at myself right now, currently, that I would not have imagined 5 years ago I would have these sorts of health outcomes or these sorts of practices. Like you mentioned meditation, like I'm huge on that. Like I meditated for a half hour before I came here. I'm going to meditate for a half hour right before lunch. I'm going to meditate a half hour right before dinner. Like it's just my thing. And there's so much that's out here that you trial and error and not being afraid to try something. And if it didn't work out, not say that doesn't work. Just say that didn't work in the way that I thought it would for me, and then try something else. And then also not just try something once, twice, 3 times. No, give me an entire set of hands and toes worth of times, you showing up your fullest self with 0 expectation to the outcome, and then see what happens and where you can take it, because the condition is such an individualized experience. Your wellness is also going to be individualized accordingly. And that's something that you have to undertake for yourself and that you have to find for yourself. No one can give you the sort of relief that you will be able to find in your own way.
Awesome. And Dawn, where do we go from here? Because we're coming right up on the questions. So where do we go from here?
I think where we go from here is knowing that there is a strong community. There are strong, amazing neurologists and MS specialists like yourself that are here to answer questions and to bounce questions and responses off of. The community is really strong. I think utilizing your voice and speaking up, which is, very, very important. Sharing your lived experience is probably one of the most valuable pieces of this MS puzzle, and that we can grow from. We can grow together. We can help clinicians. We can help researchers. We can help clinical trial experts. So going forward and just forging ahead, knowing that this community has you, and no one's going to just push you away. We're all welcoming, all encompassing.
I love it. Thank you guys so much for sharing your perspectives, and stick around. We're about to answer some questions, but thank you all for your valuable wisdom, for your vulnerability and sharing your stories, and also, for the amazing work that both of you do to help the MS community. It's always an honor to be here with you guys. So we are going to open it up for questions in the audience. Stuart's got a mic back there. We ask that if you have questions, that they are not specific medical questions, because I cannot give you medical advice. Even if I am your doctor, I can't give you medical advice from up here. So please make them generalizable to everybody, but please ask questions.
Okay, we got in the back of the room coming up to this person. By the way, everybody, only I hold the mic, one germ.
The question I have is far as concerning taking different things other than medicine to cope with the symptoms. Like I have a cousin, because of the medicine, he didn't like how it was making him feel. But he feel though that the marijuana helps him better cope with the symptoms.
Yeah, so that's an excellent question, and I think broad enough that I definitely can answer that. So when we think about MS, I think about treatment like a 4-layer cake, because I like cake. So do y'all got cake? Y'all ain't got no cake. All right. So I like cake. So first layer of the cake is if you have symptoms of a relapse, there are treatments for that, right? That's where we use steroids and things like that. The second layer of cake, disease-modifying therapy. The goal of those medications is to do 3 things, okay? Slow progression of the MS, okay, prevent new lesions on MRI, and prevent relapses, okay? What did I not say? Help your current symptoms. That is not what that medication does, okay? So the disease-modifying therapies do not help or treat the symptoms that are already present. It tries to prevent new symptoms from occurring. So then the third layer of the cake is what we call symptom management. Now, many people do use THC products as a part of symptom management. I generally counsel more for use of CBD because it doesn't have the psychoactive component that affects your cognition and your thinking, doesn't slow you down, so to speak. But again, disease modifying therapies do not fix your current symptoms. So it's important when you're talking with your doctor to set those expectations, because if that's your expectation that's going to make your numbness go away, then you're going to be disappointed and you're going to think it's not working when that's not what it's for.
Thank you. Any questions out here for anybody that wants to ask a question concerning your health care and how you're not getting the right treatment, maybe access to care, anything like that? Does anybody have a question like that? Good.
Question
Thank
over
you.
there.
Yes, Dr. Mitzi is my favorite person. But however, this is, I'll come to all her seminars if possible. I was wondering, does tremors have association with MS or not necessarily?
Okay, so again, I cannot offer specific medical advice, but there are a variety of different symptoms that can be related to MS. Tremors is one that can be related to MS, but also other things. So it's always important to talk to your doctor if you're having symptoms that you're concerned about, and make sure that they're addressing those and help you to address those with, symptom management, etc.
Okay, any other questions back here? Anybody online with a question, please type it in and I'll check it out in a few minutes. All right, well, let me get over to you. Hold on. No, let me get over to you.
Come on, Kente Cloth. I love to see
Thank you. Good afternoon, everyone. Thank you. My question is this. I'm curious about something that I heard about, but I'm not able to get an answer from the professionals on the note. It's about Kegling. We have a constant problem, people with MS, where our system becomes out of our control. And like I said, I haven't heard, and I don't know if anyone can answer the questions for me, but I know from experience that it is possible that we can learn to do that, to control, so that we can be more respected for myself, my own point of view, instead of walking around out of touch.
Okay. So Kegels. Yeah. So I haven't had that at a lunch talk in a while. So Kegels. So many people with MS can have urinary problems. I put them in two categories: gotta go, or gotta go and can't go. The Kegel exercise is it's using the muscle that we use. Like if you have to use the restroom and you stop it and then you let it go again, that essentially is a Kegel. So there are exercises that people can do to strengthen the bladder. And there actually are physical therapists who are called pelvic floor physical therapists. So there is a specific type of physical therapy where they can teach you exercises that can help with urinary issues. So again, important to talk to your doctor to see what options or resources are available to you, but there are therapists that specialize in teaching you those exercises to help.
I do them as well. That's a thing. The pelvic floor doctor. Yeah, I just had 6 sessions with her, and A through H. So there are that many sets of exercises that I have to do. Dawn knows too, because we text and stuff. So I do 10 sets, 10 different exercises of 10 sets a piece. And I do 100, or I'm supposed to do 100 of 10 varieties of Kegels per day. And it's helpful because I wake up during the night less frequently. I only wake up during the night once. And as a guy who wakes up twice a night, the same time every night, it's wonderful to find something that's technically outside of myself, but it is totally inside myself and driven by me. And I can't really put the blame on anyone else or anything else, or say that I didn't do or they didn't do. No. If I'm getting up twice a night still, maybe it's because I didn't do my 100 Kegels. Maybe I've only done 50 of them for this past couple weeks. And then who's really to blame? And so, yes, that is a thing because it's a muscle. So I go to the Kegel gym. And I treat it as such. And I'm funny like that about that in that way. I'm light about it in that way, because that's my way of figuring out how to take something that's serious to me and that will have a solid health outcome for me, but I don't really necessarily want to do. There's not necessarily like a fun thing that I'm going to get up and go, I'm going to do my Kegels today, child. No. However, I do have the program and the medical professionals to point me in the direction. However, I must walk the path myself. So yes, the Kegels work, but girl, you got to do them. They don't work if you don't work them. Thank you for coming to my TED Talk.
So I got to say something real quick. Everybody remember Damian's from Los Angeles, and they got a Kegel on every corner. They got like Starbucks.
Wow.
But ching.
It was awesome, ladies and gentlemen. Give it up for.
But thank you. I could not have said that more eloquently. So thank you for that, Damian.
So,
Yeah.
Ms.
All right.
The lady
What
in the
other
back of the
questions?
room, she would like to know, though, how you teach that to the people. That's
So again, pelvic floor physical therapist, right? So, I mean, again, it's something that you can't see. I mean, so you could be doing Kegels right now and I wouldn't know, you know what I mean? So your doctor can't really show you how to do it, you know? So again, important to talk to your doctor and see how to contact one of those therapists that can help.
Thank you. And I want to let you know on the MS Views and News Learning channel, on our YouTube channel, we've had many pelvic floor specialists do programs that you can find on our YouTube channel. So if you got nothing better to do one day, just go to our YouTube channel and type in pelvic floor, and the different programs that we've done on that will come up, and then you just listen and learn and start doing them, as Damian says. All right, I got a question for our contestants.
For our contestants?
I've got a question for our patient advocates, all right? And that is going back to the timeline, to what we're talking about here today. On your social media channels, since you both are very big in social media, when somebody tells you that they are having problems, they don't drive, they don't have any family where they live, they need to find how to get better access to getting to see a doctor, what do you tell them to do? I mean, these people are from Atlanta. They got MARTA. They got other things, but even MARTA sucks, right, everybody?
MARTA's really
MARTA's
bad. MARTA
terrible,
devil,
right? So what do you tell people to do for them to get access to better care?
Are you speaking about people who live further away from a city center?
Yes.
Yes.
I direct people initially to the organizations that are well known. I ask them to do some research, and then we kind of discuss what they've researched, as well as helping them probably call someone and just connecting to different networks. Like I said earlier, our community is pretty strong. And there are always, for example, I currently work with the newly diagnosed population, and we had a support group early last week, and this individual lives in the middle part of California, and she was told that the particular entity that she was trying to get care at, they were no longer seeing MS patients. They were not accepting MS patients. So she didn't know what was going to happen with her. And I said, this is incredible because you are in a really large state. So I started digging and doing some research for her. And then she went on to a major organization's website and then started getting names and making a phone call. And turns out that she was able to get an appointment. However, the appointment's about an hour and a half away. So she will be seen at a reputable establishment and seeing an MS specialist. It's an hour away. So to answer your question, Stuart, I suggest doing research, looking online, getting into the community, asking questions, because we all know someone who knows someone. For example, Damian knows someone in Middlebury area. And so I may know someone in South Carolina. Dr. Williams knows someone in Ohio, so reach out, ask questions, and we will help. I think that that's just the best way as of right now, because there are so many online resources and there are so many resources on social media as well.
Very good. Thank you.
Also, quickly.
Go ahead.
Y'all go.
Go ahead.
You're next.
I would say, in addition, telehealth has made a big difference, I think, in the way that we deliver care. So for people who live far away, oftentimes if they come see me that first visit in person, I may be able to do all their other visits on the computer. So again, there is that initial effort where you may have to get someone to help you to travel to a certain place to receive care. However, oftentimes you can do that once a year, and then the other visits in between, if there are other acute issues, can be done over the computer. So there are different ways to get it done. But definitely if you live kind of far away, it will involve at least one or periodic visits where you have to kind of get the logistics together to be seen in person.
Damian, you want to add to that, please, if you can?
I would just say that,
beyond the Kegels and the Starbucks. Go ahead.
Stuart Slauson, ladies and gentlemen. No, much of the MS journeys, you want it to stop. And there's so many different layers to it. There's at least 20 different symptoms that's associated with MS. So the eyes and the gait and the sensations and there's so many different layers that you have to peel off. And you have to really sort of be systematic about your approach to either each one or trying to get your care. And just know that even if it's a little bit of pressure off, even though it's not all of the pressure off, that's the beginning. And that's where you start. And you don't look that gift horse in the mouth so much. You say, thank you for this little relief. Thank you. And then work to find a little more and a little more. And I'm only saying that because that's what I do. I live it. And I'm not always on top. I'm often not on top. But I know how to sort of level myself out and then try again later, try again tomorrow. There's that idea that I'm going towards something. And even if I don't get there, the fact that I'm walking towards it means something. Because if I'm just sitting there being hurting, then I'm just precisely where I was when I was first diagnosed. And everyone, my neurologist included, can see and they put in my notes that he's doing better, even though he has a significant burden of lesions in my brain and my spine. It's there, but
and can I say I'm sorry, Damian.
Please,
can I say one more thing? Now, I'm an honest person.
Let's do it.
And we get where we want to go. If y'all want to go see Usher, I'd have seen people catch a plane, train, speedboat, right, to go to Vegas, to go see Usher, to go to whatever concert they want to go. You want to go see Beyonce? You figured out when I was in Augusta, if they wanted to go to the casino, they rent a bus and everybody goes. So now there are some cases where people physically cannot get there. But oftentimes, if we really want to do something, we will figure out a way to get there. I had a patient and it was interesting. They had been having all this trouble and they were calling me. They were like, yeah, Dr. Mitzi, everything kicked off after I got back from Aruba. And I was like, Aruba? I ain't been to Aruba, Not that you can't go on vacation, but the point is, if we want to do something bad enough, we will call a cousin, an auntie, a friend, second, twice removed, right?
Facts.
And get a ride
Facts.
to get where we need to go. And so that same sense of urgency that we have to do things that we want to engage in for fun, which you absolutely 100% deserve. Let's also bring that same energy when it is time to take care of our bodies, right? Because you won't be able to have fun if you're not taking care of your body and not getting that seen about. And that's all I got to say.
Great. Thank you for that. There's a question online. A person wants to know where they could get cognitive behavioral therapy.
Yeah, so cognitive behavioral therapy is basically, so we look at it in a couple of different ways. So cognitive behavioral therapy is a specific type of therapy we use to treat conditions like depression. So that's what we call it when you see the psychiatrist and you see the psychologist. So certainly those are often provided through mental health specialists, but also there is cognitive therapy, which is given for people with MS who have cognitive problems like difficulty with your thinking, where your thinking is slowed. And there are neuropsychologists who do that. So there are, again, two different types. For depression, when people are treated, we call that cognitive behavioral therapy, but also cognitive therapy, which is done through a neuropsychologist. So again, important to talk to your doctor, tell them which issue that you're having, and they can direct you to the appropriate specialist who can address that.
Great, thank you. Any other questions to do with access to care and all these other things about bad therapy and where to get it from and things like that? I'm glad.
Hi, thank you. My name is Erica. I'm a physical therapist. Well, I just stopped working. I've had MS for 36 years now. and I finally got into my scooter. So this is my limo now. But as far as transportation in the Atlanta area, I've had good success with MARTA mobility. Only one time did they break down on me, but everything else has been pretty good. They don't go to Henry County though, and I need that because most of my doctors are at Piedmont. But when I go to Shepherd, MARTA mobility is always there for me. My question is for Damian, and tell me your name again, honey. I'm so sorry. My question is, how do I get involved in what you both are doing? I've renewed my license because I figure I can do something online, teaching, advocating, something, but I need to do something, and I'd love to get into the multiple sclerosis community like you guys are. So how do I do that? And for the doctor, have you heard anything about exonics therapy? That's like 4 different questions.
She has time
So
for
my
two.
answer is easy. No. That's my easy answer. So no, I have not heard of that, but certainly will go and look it up when I leave here. All right, so I'll give it to you guys.
Exonics,
Amen.
get your bladder back. Okay.
Yeah. We just had this discussion, so I'll let you take it, Damian, how you get involved, and then I'll speak. Yeah.
Like I got involved by accident. Like I say, I was doing something else and trying to do something else, and then this just sort of grew under me. And I think that one must show up with zero expectation as to the outcome. And when you just show up over time, what you are, what people want to see from you will come. And so you might want to show up in this one specific way for MS people, and it's just not working, no matter how much you adjust it. Something else will come out of the practice of you showing up regularly. And that seems like an amorphous kind of, that's not really an answer, young man, type of an answer. But it's just so real, because I could not have laid this path. I could not have told you how I became the guy with 6,000 subscribers on YouTube and is talking with Genentech and Novartis. And I couldn't have told you how I did that. However, I can tell you how I got this YouTube channel. And how I got the YouTube channel, I made a video a week for 8 months and nobody watched. Nobody. You know how long you have to show up every single week with no one watching, but still show up? That's the part that will propel you and get you through to the point where as soon as you figure out what people want to watch from you, oh, you can do this, you can do the standing on your head. And then you pump it out. And then 2-3 years later, you're that person that's known for that thing in that way. Show up. And then when it's not working, as you figure out how to show up still, if people gravitate toward that, that's what your thing will be.
And to piggyback off of what you're saying, Damian, I think because we have this conversation quite a bit, showing up and being consistent, and the fact that you are a physical therapist and that you've had training, I think that is extremely valuable. I mean, you could start a YouTube channel, and the fact that you have MS, people are going to listen to you. And being a person of color, I can't really see the audience, but that is really valuable to the community, especially African American, the African American community. I think that we are looking for other ways to manage the MS symptoms, and physical therapy is certainly one of the key factors that assists in management of this, this crazy disease. So getting started, remaining consistent, showing up, as Damian said, and there's enough space for all of us. I mean, YouTube is huge and the stage is huge, and we need more people to come in and share their expertise. Sharing your expertise is the best way to dive in.
Thank you. Anybody else? Dr. Williams, you got more to say? I got something to say.
Yeah,
if
I
you
would
don't want
add
to say,
to
but go
that.
ahead.
I always have something to say. Again, very similar to Damian and Dawn. The path that I took to being an advocate and really educating people was not something that I thought I would be doing. I very much thought I was going to be a pediatrician and, go to work and take care of little sick kids and go home and raise my family, right? So, you never know what impact you will have on people. I think the other thing I would encourage is to look to see who's in their space, right? There are several people who are involved in physical therapy with MS, people who are involved in yoga and MS, exercise and MS, and kind of look at some of those examples, maybe connect with those people, kind of see what things you like about the way they do their platforms and maybe what things you would do differently, and then just create your own space. The best thing you can do is be your authentic self, and whoever is for you will gravitate toward you. And that's all I got to say.
I was going to suggest that you just get out there, and whether you do it on Facebook or you do it just live stream, try to promote that you're here in Atlanta, you've got MS, and you want to show people what's benefited you and show that it could benefit them as well. I mean, I love Atlanta, all right? I mean, we come up here to do programs because I know that, it's empowering for me to be here just to do these kinds of programs. So I come back all the time. But if we had an empty room, I'm not going to come back. But we just got the right doctor, and or doctors. And we don't use that many in this area because they don't want to see anybody else but those two people. So, or maybe three people.
Oh, you hyping me up. But again, back to what Damian said, though, that consistency in showing up is extremely important. When I first started doing Facebook Lives, I would be in my little room in my office. My daughter would be in the tub next door yelling at me, "Mama, come get me." You know what I mean? And so nobody would watch those first ones. I have done talks where there's been one person in the room. I have done talks where I have flown out of the country. There was nobody in the room but the moderator, right? So again, that consistency, right? With each opportunity, you learn something, right? And with each learning, it helps you to improve what you want to say, how you want to say it, how you want to express yourself, and how you're going to communicate with those people that you're intended to reach.
Question over here.
That part.
Yeah.
The similarity between axonics and bladder control, is there a variation?
So I am not familiar with axonics. So I'm not a urologist. So, Dr. Mitzi Lane over here, axonics over here. Okay. So certainly there are many different ways that treatments have developed for the bladder. I know that there are a lot of people who get Botox in the bladder, and that was not something that was being done when I first came into practice. So when we are looking at more advanced therapies, oftentimes I will refer you to that specialist, which would likely be a urologist, who can kind of help guide you through the treatment options and be more knowledgeable about some of the newer techniques that are being used to treat those issues.
Looking on the
Absolutely.
Axonics website right now, the first thing they say is consult with your doctor. That's a thing. And I'm here and I'm like, oh, Axonics, great. Oh, is Axonics right for me? Number one, consult with your doctor. So as much as folk around you always say that first, that's a thing. And we can't provide medical advice. I provide medical insights, and my insights is talk to your doctor. But here's all the stuff that I know, but also talk to your doctor. And if that person is not the person, find another doctor until you have the team that you want. You're the coach, you're the player, you're the audience as well, you're the ticket buyer. You're all of the people in the arena. And that's a strange metaphor. Like, I've really actually never used it before.
Yeah, that's kind of weird.
We got another question in the back of the room. We got another question back here. Sorry to cut you off, Damian, but if I don't, you're going to go on all day. So.
Hello, my name is Chantel Natasha Small. My initials are CNS. How?
Wow.
My question is for all you guys. What have you heard about stem cell patches?
So again, consult your healthcare provider. So the long and short of it is there are a lot of different treatments, interventions that are called stem cell. Okay. Now, when we talk about stem cell treatments that we have research evidence for that change the course of MS, we are talking about traditional stem cell therapy, like what people get for cancer. Okay. Where they take your cells, they wipe out your immune system, they clean your cells, give them back to you, and you regrow your immune system. Okay. So when we talk about what we have proven evidence for, that's really the only type of stem cell we have proven evidence for. There are many other things that people do that are called stem cell, whether it is do a little liposuction and give you some cells back. I got people that go to Mexico and get all kind of stuff. I don't know what they get. Now there are patches and pills that people take. The bottom line is, always consult your doctor about any type of new thing you're considering trying. Recognize that if there is not a lot of research behind it, we can't really give you a lot of advice about whether it helps or not. And then also realize it costs money, right? So I have some people where we say, hey, we talk about it. I'm like, I don't know that much about it. I look up and we say, okay, well, if you want to give it a try, go ahead. I have some people that will, get swindled out of thousands of dollars to do different things that don't really help, So again, always consult your doctor, but recognize the only stem cell therapy that we have research for that is proven to help change the course of MS is traditional, what we call hematopoietic stem cell transplant. And that's what people with cancer get.
Thank you. If there's no more questions, I'm going to say thank you to our patient advocates, Dawn, Damian, thank you very much for being there. Raise your hands, say thank you. There you go. Round of applause.
You guys are amazing.
Awesome. Thank you. And I'm going to, Dawn, I'm going to see you in a couple months because we'll be up in the Maryland area. I already spoke to Camilla, so we're getting things going, all right? Okay, awesome. Thank you for that. And Damian, like always, thank you, and I hope to see you online shortly again.
My guy so fly. Great to see you, Stuart.
Do what? English, please.
My guy so fly. Great to see you, Stuart.
Thank you.
Big homie to one and only.
Thank you. Thank you. There's multiple syllables there. I didn't get it. All right. And Dr. Williams, of course. All right.
Thank you, guys. Thank you, guys.
Thank you, everybody, for coming.